Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, June 3rd. Our County of Monterey Health Department has successfully completed a review process to maintain its national accreditation. This is a very big deal, and we're going to find out more about what this means to the health department, to the clients that it serves. We're very pleased to have our director of the health department, Elsa Jimenez, here to tell us more about this achievement. Hi, Elsa.
Hi, good afternoon. Thank you for having us. We also have Shabani Sumashar, who is our manager over public health accreditation, that will join me this afternoon to really lift up and celebrate the fact that our health department has received public health accreditation or reaccreditation for the next 5 years. So many of you might remember back in 2007 or so, many counties and states were going through public health accreditation process. The Public Health Accreditation Board, which is a nonprofit agency, really established national standards for government public health departments, really creating a rigorous peer review process to make sure that local health departments, whether they were in counties, cities, or states across the nation, were really fulfilling their mandated, obligated services to really ensure that the residents in those communities were receiving what they needed. And so we were one of the first, we were the 11th actual county in California back in 2007 to receive public health accreditation. And we're going through reaccreditation process during COVID. And so things had to be delayed. So now I'm very happy to be here with you all today to really celebrate that we've received notice that we have received our accreditation and will be accredited for the next 5 years. And this really reflects your county health department's commitment to excellence, accountability, continuous improvement, and really ensuring that we're doing everything we can to advance the health and well-being of our Monterey County residents, with a particular focus on those residents that are in most need of our care and services. You know, maintaining our accreditation really helps to lift up that you can trust the services that your local health department is delivering, whether that's in our public health bureau, you know, with your home visits, with your public health nurse, whether that's when you receive reports that, the rates of whooping cough is up, that you have staff at the health department that are keeping a pulse on what's happening in our community and really doing what we can to ensure that our residents have what they need to be able to live long, healthy lives. And it really gives us a measure. There are metrics that we have to follow, and it really hopefully helps to solidify the public's trust in the services that they're receiving, and that we are really meeting all those measures. It confirms that our systems are designed in a way to make sure that we are constantly assessing the community's health needs, that we're planning strategically with our community-based partners, stakeholders, and with residents, and really evaluating what we're implementing and implementing a continuous quality improvement. So with that, I kind of wanted to just transition maybe to Sheba to add a little bit, and more importantly, talk about what is it that you as a community member or you as a stakeholder in our vast public health system can expect from us and as an organization going forward.
Thank you, Elsa. So while we're proud of this achievement, the reaccreditation is not the finish line. It's just a milestone in our journey of continuous improvement. So over the next 5 years, we're going to continue strengthening the systems, partnerships, and practices that support Monterey County health residents. We're going to continue implementing the priorities identified through our community health assessment and community health improvement plan, working alongside community partners to address some of the county's most pressing challenges. And one of the most important lessons reinforced throughout the accreditation process is that meaningful public health improvement cannot happen in isolation. So we're going to continue collaborating with healthcare providers, schools, community-based organizations, local government partners, and residents to develop and implement solutions that improve health outcomes throughout Monterey County. A major focus moving forward will be advancing health equity and reducing disparities across the communities. We remain committed to ensuring that all residents, regardless of where they live, their income, language, background, or circumstances, have opportunities to achieve the highest level of health. The accreditation process challenges to evaluate our performances, identify opportunities for improvement, and strengthen accountability across the department. And these efforts will continue. We will continue investing in quality improvement, workforce development, performance management, community engagement, and data-informed decision-making to ensure that we remain responsive to emerging public health needs. So I just want to validate that reaccreditation validates the strong foundation we have built together, but it also positions us to continue evolving and improving. And we are grateful to our staff, our partners, and community members for helping making this achievement possible. We look forward to continuing our work to protect and improve the health of all Monterey County residents.
Thank you, Sheba. And then I'll just emphasize, we really want to lift up just the major contributions of our health department staff across all of our bureaus, who every day continue to do what they need to do to ensure that our services are meeting the residents' need, that they're very much aligned to the department's mission. And without them continuing to do this service, we wouldn't have been successful in terms of meeting all the expectations and requirements for public health accreditation. And additionally, it doesn't just sit with our staff. It really relies on our partners, both across our healthcare partners, our hospital partners, our partners across the schools, community-based organizations, tribal partners, other local governments, our first responders, and more importantly, the community members, really ensuring that they work with us to help inform the systems that are here to serve them, to make sure that the services are delivered in a way that is accessible to them, to ensure that we're all partnering together again, to ensure that, for the most part, most of our residents have an ability to thrive regardless of where they live in the community. And we hope to continue to involve the community and our public health system partners as we roll out our community health improvement plan that is really going to be our guiding document that will help to ensure the services that we as a health department and partners in the public health system are working towards to ensure to meet the goals of that community health improvement plan, and hopefully help to advance some of our overarching goals as part of the health department's current 3-year strategic plan. So with that, we will entertain any questions that the participating members may have regarding our new notification of us achieving public health accreditation.
And it's just such great news. And I think people don't understand the complexity of going through an accreditation process. And so we might not want to scare everyone off about how hard the work is. But what do you think it was that helped push the County of Monterey into the accreditation? What was it that the board really liked or saw that we were doing right that got the accreditation over the finish line?
Did you want to take that one, Sheba, or?
Trying to think off the top of my head. I believe it was the collaboration and the projects that we had completed, the teamwork, and ensuring that we were addressing our community health improvement plan, the needs in there. So we provided the examples out there, and it just was clear to them that we were pressing through our assessment and the actual needs for the clients and throughout the community, and we were addressing the needs and moving forward with our plan. So that was one of the biggest things that we noticed. Also that our internal team worked very well together, all the bureaus, and during the process where they came to interview us, it was very clear that we have a good communication process, and that really helped.
And so, yeah, and for people who are in the community, the people who are your clients, the people who are going to come to you for services, it really matters that everyone is working well together. You may think it's a layer of bureaucracy that you have bureaus, but if they're not working, they're not getting the services out into the community.
Most definitely. And I think just to further stress what my colleague Sheba stated, it's not just that us as a health department that we have policies and procedures that are current and relevant and that we're abiding by them, but that we recognize that in order for us to preserve public health, whether it's, at the individual level, at the family level, at the community level, and even at the environmental level, that we can't be working in silos, that we have to have those strong working relationship with members, representatives across all other systems, whether it's the public, the private, the schools, faith-based, community-based organizations, etc., and with the residents. I think one thing that really helped to lift up that we truly are here to serve the needs of our residents, the constituent, right? Whether they're accessing our services or not directly, is that we make meaningful efforts across our organization to engage directly with the community. We create safe spaces for the community to be able to share with us what their concerns are, what their needs are, and that we strategize with them in terms of what the priorities are. We help to secure funding to be able to then meet the community's needs. And so I think the fact that we're working across the entire public health system and working directly with community and lifting up those areas that have been disinvested in and trying to be creative about how we fill in those gaps really help to, make our application stand out.
Well, it's really great news, and there's a lot of hard work that went into that. And so congratulations to everybody. And now you don't have to do it again for 5 years, right?
Well, it never really stops. As Sheba said, it's like, okay, great, we've been reaccredited, but now we have our community health improvement plan that we have to work towards modifying it and implementing it, the annual reporting, and then probably halfway through, we'll have to go back through and refresh all of our policies and procedures and ensure that all of our staff are trained and see themselves in our health department strategic plan, and that we're implementing quality improvement processes, right? I mean, one thing that we really do stress and want to stress at the organization level is that just because we've been delivering services a certain way or we've been delivering a specific type of service, it doesn't necessarily mean that that's what our community needs most now. So this constant quality, continuous quality improvement processes are ongoing. And then probably 12 months before the end of it's the beginning of submitting documentation and examples and refreshing policy. So it's doesn't really start and stop, but now it's like, yes, we received this tremendous work behind not only doing what we do every day, but also helping us to submit all the required documentation to submit for our application for reaccreditation. But now we need to make sure that we follow through and continue to improve our services for our residents.
And so Sheba, you only get a minute. You're only going to get it.
She covered it all. She covered it all.
Thank you so much for sharing with us, and congratulations on all that hard work and the achievement.
Thank you.
So we're going to move on to our next topic. This next topic is about our community climate action and adaptation plan. The community has been involved in the process of this plan for quite some time, but now the public comment period is open, and we're hoping to get more about this. I see we've got Hannah Cornfield, who has been working on the plan with our county sustainability manager. Hannah, I'm wondering if you're able to jump in. I don't see Cora on the call, but can you jump in and talk about the comment period? Hannah? Well, we've got a few technical problems. We're not able to hear Hannah, or she can't hear us. So we'll try to get that information on our next news briefing. And so it's going to be an abbreviated news briefing today. Thanks for joining us. Our next briefing is next week, and we'll see you then.